Hey everybody, we're following up with the videos on clinical pearls. Please excuse, I hope they Photoshop the looks off of having to look at me. We're doing some work on total knee replacements. We're talking about phase one. All right, I want to try and make sure everyone gets some degree of similarity when it comes to progressing these patients through phase one of the rehab. Right? Obviously, you're going to get past your evaluation and make sure there are no complicating factors. We're going to then move forward. Whether the patient needs modalities pre or post is your call, depending on the extent of the inflammation. We do like to try and progress quickly towards an active warm-up on the short crank bike. I want them flushed. Right after the active warm-up, when they've loosened up the joint and they've got a good flush, we like to go to a low-load extension stretch. Pretty much immediately I like to work on extension. Obviously you're telling the patient how important it is to get extension of the knee. Low-load extension. At the end, I like to do a little soft tissue work to try and make sure the patella is moving appropriately and posterior knee is okay. Obviously after we clear Homans and all that, right? Once they're extended, they're not going to have an easy time flexing, so we're not going to go to that until the end. Sometimes I put them back on the bike, but typically I go right to the proprio work to sort of loosen up the joint a little bit. Right after they're done extending, it's going to be tight because of fluid dynamics. It lets them loosen up, it gains the proprio. We like to do proprio before we do PREs or anything strenuous because it's better while they're fresh to get the balance down. Then you do your basic PREs, some total gym, some mini steps, weight shifts, that kind of work. At the end, if you need them because they're really tight, you can get them on the bike again. Sometimes I'll drop the seat height consecutively as they're going down, start them high and bring them down every couple minutes. If they're not having any problems, you sit them on the edge and you try and get flexion. I don't love the heel slide for flexion stretches because it compresses the posterior part of the joint. I way prefer sitting. Let them be in control, use their other leg to help, and do a static low load stretch, 10, 15, 20 seconds, okay? Maybe 10, 5 repetitions, 5 or 10 repetitions, whatever it takes, to let them loosen the joint on their own. If they're doing well, I rarely put overpressure. I let us follow them into the range of motion. If I clear 90 quickly, by the 2-week, 3-week mark out, I'm clearing 90. I never do any overpressure. Lastly, my home instructions. Every single hour at the top of the hour is a low load extension stretch, 3 or 4 minutes. That's integral to maintaining the gains. At the bottom of every single hour, we do a flexion stretch. Okay? They sit for a couple of minutes in a chair and slide themselves forward, or they do the hook and ladder right across in the front. I insist they do quad sets and the 90 to 45 degree, I call it the wiggle waggle, it's very technical, obsessively. 3 shots of espresso all day long, they can't sit still, they don't stop moving. That's pretty much it in a nutshell. I'd like you guys to follow that sequence, it's been working really well. This way when our therapists work with patients they inherit, there's similarities along the way. Thanks for bearing with me.